Hello and welcome to this edition of the ILO's Future of Work podcast. I'm Sophie Fisher. Today we are going to look at mental health and psychosocial risks at work. Every year on the 10th of October we mark World Mental Health Day. This year the World Health Organization and the ILO have sounded an alarm, calling for concrete action to address mental health issues. Their data has estimated that 12 billion working days are lost every year through depression or anxiety alone. This is costing the global economy almost $1 trillion. What's more, it seems that the COVID-19 crisis and the lockdowns and disruption that came with it have made the mental health situation more acute. So, what can we do to improve mental health in the workplace? Joining me to discuss this are Nina Hedgaard Nielsen and Susanna Harkonnen. Nina Nielsen is joining us from Copenhagen in Denmark, where she is Chief Policy Advisor on Occupational Health and Safety at the Danish Confederation of Professional Associations. She is a qualified occupational psychologist and international consultant on occupational health and safety, specializing in psychosocial risks, violence and harassment, workplace representation and working time. For more than a decade, she's worked with the Danish trade unions and the Danish Labour Inspectorate, looking at psychosocial risks in workplaces. Susanna Harkonnen is with me in our Geneva studio. She is founder of Inner Work. That's an umbrella grouping of professionals and companies working on all aspects of mental health. She's a member of the WHO's Pan-European Working Group on Workplace Mental Health. She has master's degrees in counselling psychology and business administration and advises organisations and leaders on psychosocial health and safety at work. Welcome to you both, Susanna and Nina. Thank you very much for joining us. Let me start by asking you, why does this issue matter? Susanna, let me start with you.
The numbers around mental health are quite staggering. So depending on the statistic, depending on the source, it can be anything from 30 to even 90% of people who have been impacted by mental health challenges. And now when we talk about mental health, we are not talking about mental illness. We all have mental health, just as we have physical health. And then there's mental health and mental ill health. So it's important to make a difference. But at the moment, many people are unwell. None of today's stressors are normal. And yet there's more than 90% of staff who wants to work for a mentally healthy organization. This is in particular the case with the younger generation. So we can no longer ignore this.
Nina, I have seen statistics that say that more than half of all the working days lost in the European Union can be linked to work-related stress, and that depression alone is estimated to have cost the EU 600 billion euros. Do you think that's accurate, or is that an overestimation?
Well, I think it's accurate or maybe an underestimation, actually, because there are so many people that are infected by stress and mental illness. And often people, when they call in sick, they won't say that they're sick because of stress. They may say they have the flu, or they may have a sore throat, or just say nothing. Because it's still a stigma, and I don't know anybody who doesn't know anybody in their family or in their close relation that has been ill with stress. It is a huge problem. So I don't think it's an understatement. I think it's an understatement, not an overstatement, actually.
Susanna, you work a lot with private clients and with organisations on workplace mental health issues. Can you give us some examples of some of the ways this has manifested itself?
With individuals often it's related to working hours. It's probably the biggest one. Too long. There's no limits. Holidays, you still have to clock in, or you're expected to. You're not officially expected to, but in actual practice, the company culture, organizational culture supports it. And so that's probably the biggest one, or the work pace as well. And then one which I'm seeing increasingly is that individuals are getting frustrated because the companies are saying one thing and doing another. So the public discourse says, oh, we care for our employees, we care for their mental health, but nothing is being done in actual practice. That makes people very angry and very upset. And actually, there's a recent research about this, and resentment and anger are the prevailing emotions among employees in the workplace.
And do you think that COVID-19 made this worse? Or do you think the levels that we're seeing now, were they always there and we just didn't notice until after people became more aware of these issues because of COVID?
I think that the issues were already there before COVID, and COVID just made them visible. It may have exaggerated those in a couple of areas, but by and large, they were definitely there before that. And I'm glad that we can now speak about them, because before COVID, even mentioning stress to organizations was a little bit of a taboo.
And tell us a bit more about some of the things that cause psychosocial problems, psychosocial risks at work.
Well, in the recent WHO and ILO report, the recommendations on mental health at work, they identified 10 risks. So, for example, we already mentioned working hours and work pace, work schedules, control of one's work, environment and equipment, interpersonal relationship at work is a huge one at the moment, because when people are unwell, they have a hard time relating well. And then emotions may come to the surface that are not very constructive. Their role in organization is one of them. Career development that's being stalled. And then homework interface is a bigger and bigger issue at the moment because of COVID. How do we navigate that space? For some people, it's a positive thing. For some, it's not. And it's hard, the companies are still struggling with finding the right balance with home, working from home and working in the office.
I mean, there is, of course, a culture in some organizations whereby, the quality of your work and the quality of your dedication to the organization is measured in the amount of hours you're prepared to work and the amount of personal commitments you're prepared to give up for your employer. Nina, you're a labor inspector. Is this something you've come across?
Yeah, definitely. So also you come across what we can call shadow work, where you actually have workers staying longer on working in their breaks, not saying that they do some extra work because they don't want their managers to tell them not to, because this is the meaning of their work to do this. And this is usually occurs in sectors where you work with people like patients or students or citizens, where you just feel that you spend too much time on bureaucratic procedures, registration, or just have too much to do, so you can't give the care to the patients if you're a nurse that you feel that you have to give, and then your work just loses the meaning. And I think that's one thing to add to the list. I completely agree with the list ILO and WHO has made, but I think the meaning of work is also really, really important. The fact that when you leave your workplace, you feel that you've done something that actually makes a difference, and that makes people ill when they're not capable of doing that. And on top of that, if you have a manager that pressures you, or you have co-workers you don't have time to speak to, or nobody seems to understand you, that you don't get any autonomy or control of your work, then you have the cocktail that really makes people ill.
Now, I can hear managers and employers saying, well, we can't regulate for stress and mental health. Some employees are more prone to it, some are not. It's not an issue for us. What would you say to that, Nina?
Well, I would say two things. First of all, you say that people are different. That's basically what they're saying. They say that, of course, because we are different and we have different personalities, we have different skills, we have different mental health, then we can't regulate because it's basically an individual problem. And to that, I would say, look at, for example, how we regulate chemical substances. Here we say that if 1 in 1,000, just to give an example, can develop cancer for being exposed to a dangerous substance for 40 years and 8 hours a day, that's quite a lot, then that is too much. Then we need to regulate and we need to lower that limit value. But of course, you also have different genetical mix-up. Some people get cancer, some don't. That is also an individual difference. It's not your fault. When it's an individual difference in your psychosocial or your mental makeup, then we say it's your own fault. And I think that's basically a problem. And that is what that is what is changing now. And I'm really happy about that you're trying to change the concept and saying it's about the environment. It's about what you are exposed to, the hazards you're exposed to in the psychosocial working environment. And those you can regulate about. So that was my first point. The second point is we have countries that done it. We did it in Denmark in 2020. They did it in Sweden 10 years ago. Belgium's done it. There are other countries all over the world that's done it. And what you do here is that you pinpoint those risk factors that Susanna mentioned before. Also, you pinpoint them in the regulation. You say that your workload has to be manageable within the time. So you can't put more workload or more tasks on people than they have time to do, for example. It's not a limit value. You can't do that, but it's pinpointing what is actually, what is that you have to do as an employer. You have to make sure that this is safe and healthy. And that also gives the labor inspector the means to go and inspect this. And I've done that myself, and you can do that. You can make improvement notices saying, well, this is just unhealthy because the workload is too high, or there is mobbing going on, there's harassment going on, there's violence or threats of violence, it's unclear objectives, it's unclear job demands. You can make improvement notice, or you can even fine employers for not actually dealing with that. So it's definitely possible. It's a little bit different from what we do when you look at the physical occupational health and safety, but you can do it, and you can, and thereby you can avoid saying it's the individual's fault, basically.
It's important that organizations build an enabling environment. So there are basic 3 steps that companies can do, organizations. This applies to both. First of all, they need to prevent harm. It's employers' duty to prevent harm, just as Nina said. So there are these lists, there are checklists, there are wonderful resources for companies to go after. Then the second step is to protect and to promote. And the protection and promotion is, the strengthening of awareness of mental health issues, of stress, and also training of especially managers. This is the biggest gap perhaps in organizations at the moment, that the managers don't know what to do, and they've been thrown into the role of mental health providers, counselors, when it's absolutely not in their skill set.
Yeah, it's easy to dump everything on managers and say it's poor management, but maybe they need to be given the tools to do this.
They do. And if you look at business schools and training, for example, there's absolutely nothing around these topics. Now it's coming slowly in some of the leading business schools. But I work in this space as well, and it's quite shocking, actually, how little is being done in this area. So you cannot, the blind cannot lead the blind. But to go back to that model, the 3-step model, so prevent, 2, protect and promote, and 3, support. Support those who are unwell, who have actually mental ill health rather than mental health. And with that package, you create an enabling environment. And I have seen this in practice when organizations embrace this model, it does make a difference. It doesn't happen overnight, but the culture will change.
So it is a cultural change as well as specific measures.
It is cultural change, yes.
Is that one of the signs of a healthy employment organization, would you say? A culture that respects and values and looks out for mental health?
Yes, absolutely. And the younger generation really does want to work for organizations that are healthy.
I totally agree with the training of managers. And I think just to give you some idea of also what we're talking about, we have been doing this in the Danish trade unions through collective agreements. And we have completely oversigned, what you say, that's just too many managers who wants to join these courses, then we have seats, basically. So it's so popular because the managers themselves are saying, we want to deal with this, but we just don't know how, because it's not that easy. Give us some help. So I think also as trade unions and as social partners, we should also do this together and to make sure that there is a possibility for managers to get this training, because it matters what the training is about also. In my perspective, perspective, it's really important to train the managers in the psychosocial risks and how to organize work in a healthy way. So you shouldn't expect them, like you say, Susanna, to be like mental health counselors or doing like therapy with their workers. No, their job is to organize work and to make a good environment where people cooperate and support each other. So I think that's the focus for the management training.
But I think that managers at the moment are the most stressed group in workplaces. So I mean, I've seen some statistics where 96% of managers or leaders feel burned out. Over 70 have experienced depression. More than over 60 no longer want to lead. I mean, these are shocking statistics, and my experience is the same as Nina's when I work with managers or I train them. There's a certain level of desperation saying like we have to be everything for everybody and who's taking care of us.
So they are passing down the stress to the lower level employees. So what you mean that actually this is a message that has to come right from the top, what is often called the C-suite or senior management?
Yes, this change does have to happen at that level. Because otherwise you throw this at managers, and especially HR is caught between the rock and the hard place these days. They don't have the means, they don't have the budgets, and they are expected to do miracles basically with nothing. So all very little, let's put it that way. So I'm advocating absolutely. It's very, very important that C-suite embraces this and sends a clear message. And in those organizations that I have worked with, where the C-suite is behind it, the culture is different, and the managers are also, even though it may not be perfect, because there's no perfect organization, it's still much better.
Right. Let me put to you both a final question. What I'd like to know is whether you think we really are at a moment of change. On the one hand, COVID-19 has brought to the fore issues of mental health and workplace. On the other hand, we are going into what look like very dire economic times when companies and employers are going to be watching every penny. So, are we really at a moment of change for mental health in the workplace, or is this a false dawn? Susanna, let me start with you.
I think that we are at the threshold of an industrial revolution 2.0. We can no longer ignore this. The stresses that we have around in the current world, we cannot ignore them, and mental health has to be improved if we are to survive as organizations.
Nina, what do you think?
Yeah, I agree. And I think what we have to do now is we have to look more about the work we're doing and the priorities we have in the workplaces, because are we doing the right tasks, basically? Are we doing too much? Are we doing the wrong things? Because if we have to save money on one hand and also protect the workers' mental health, that is completely necessary. So we may look into a few years where things will not get better, not just at these next few years, but I think after that, I think we're going to see a change because after COVID-19 and after this crisis, I think we've learned so much. And like Susanna says, we cannot ignore it. So we will start working on it and maybe finally start to realize that the psyche has also limitations. It's like we say, we can just put a little bit more on top of, a little bit more on top. You can do a little bit more. You can do a little bit faster. And we know that the body can't do that. So why is it that we keep thinking that we can do that when we look at people's mental health?
That's a great note to finish on. So Nina Nielsen and Susanna Harkinen, thank you so much for your time and your contribution, because that's all we have time for in this show. Thank you too to you, our audience, and I hope you will join us again soon for another ILO Future of Work podcast. For now, goodbye.